And then casting a bit wider net, I'd like to understand if he has any other renal disease, and then also moving on to whether he has any other medical problems, which could also be causing this gentleman's hyperkalemia. So thinking about endocrine disorders that cause hyperkalemia, medications that could cause, that you might have newly started that can cause hyperkalemia, or any medications that can be toxins that can indirectly cause hyperkalemia, such as NSAIDs or trimethoprim.
So at this point, the patient tells you that they have not been taking any extra medications. They don't have any other general medical problems, and they're just been feeling very unwell in the last couple of days since they ran a marathon. They're normally very fit and well.
Okay, so I think when you're thinking about this scenario, it's a young patient with hyperkalemia. I think in every renal interview over the last at least 5 years, hyperkalemia has come up in some form or another. And so it would be fairly remiss to not have prepared a very structured, very slick and succinct answer for this station. And if you haven't, now is definitely the time to do so. So with this patient, the very first thing with hyperkalemia in this scenario or in any scenario is to ensure the patient is stable. So I think that was done very well, for example, in this answer, when you say, I would ensure with A&E that the patient was stable. And at that point, you can also highlight your knowledge about managing hyperkalemia, which they will expect you to know like the back of your hand. Insulin dextrose, calcium gluconate, salbutamol nebs, plus minus a potassium binder.
I didn't have a chance to think about time too much, to be honest with you. I was just trying to make sure I gave the main answers quickly. And I think one thing I learned from the course was front loading your answers.
Yeah.
So I made sure to do that when answering these questions.
Yeah, no, I think that's absolutely key, because the time just absolutely flies in these interviews, and you've only got 10 minutes and 6 minutes respectively for your clinical cases. So it's a case of getting it all across.
Is the golden numbers of 140 over 80. Some people will say 150 over 90. You certainly don't really want to go above that. And trying to alter their blood pressure on the day of a biopsy is not advisable, because actually you probably just alter that one reading and then it will bounce back afterwards and cause them to bleed. So ideally, you should be having discussions about biopsies with patients in clinic prior to this, giving them a leaflet, checking their blood pressure, checking their coagulation status, making sure that they're not on any kind of antiplatelets or anticoagulation, so that you can proceed. Okay. So that's the first thing. Then it's, how do we perform the procedure? So I often explain to patients, how we're going to do this is, if it's a native biopsy, I'm going to get you to lie on your front. I show them roughly where the kidney